Hello. Hi, everybody. Welcome back to another episode of What's on Your Mind. I'm your host, Nimade Belu. I'm so excited to bring you another great guest. It is Women's History Month, so I'm talking to some dynamic women in the mental health field about things related to mental health, women, and all of those good things. So today I have with me Alicia Emmanuel. She is the Deputy of Addiction Services. We're going to be discussing the impact of addiction on women in our community. Hi, Alicia. Thanks for joining us.
How are you?
I'm good. I'm good. Now, Alicia is an experienced supervisor with a demonstrated history of working with nonprofit organizations. She's skilled in clinical research, supervisory skills, technotherapy, program development, mental health, and she's a strong professional with a doctorate of psychology, focused on counselor education and supervision. And you have so many letters following your name. There's Ph.D., LPC, AADC. First of all, can you tell us what some of those are and just a little bit about yourself?
Yes, no problem. So one of the things as a licensed professional counselor, so that's the LPC, just gives me the opportunity to be professionally licensed in the state of Pennsylvania as well as Delaware to do the wonderful things that I do on a regular basis. And the CAADC is the Certified Advanced Addiction Counselor degree. So with all my years of experience in the addiction field, it was one of the um, routes to go in terms of addiction counseling.
Nice. And how long have you been in that field?
Oh, goodness. Great question. Hmm, Over 10 years. So I definitely know it's over 10 years. I want to say it's either 11 or 12, but
Nice. And so, as I mentioned, it's Women's History Month, so we're going to focus in on women. So I'm going to jump in with a question about that. What specific challenges do you notice that women face when seeking treatment for addiction? And like, how do those challenges maybe differ from men?
okay. Really great question. So I think historically, typically men have higher reported rates of substance abuse and misuse or dependency. And I'm going to be very clear. I'm saying reported rates doesn't mean that we don't have women experiencing the same concerns or issues. But typically, what you notice is that women are the ones who are home or maybe home with kids or who are the individuals who are taking care of family members at home specifically. So a lot of times it's not reported because specifically they may not be getting treated for those symptoms.
Hmm.
And the other issue that typically comes up with women as well is in many cases, some of the experiences with substance abuse may be mirrored or masked because they're similar to mental health struggles as well, and even postpartum. So a lot of times it's not reported, but it doesn't mean they're not facing those struggles and those issues.
So you're saying sometimes like they'll come in and maybe they'll think it's postpartum or something mental health related, and they're able to kind of, I guess, mask that it might be an addiction problem.
Correct. And on top of that, you have a lot of things that deal with, how can I put it, stigma, right? So you think about the stigma that goes into it.
Mhm.
So women who are, they have children, they're dealing with an addiction, and then they're still expected to go to work or they're still expected to take care of home, doesn't leave a whole lot of time to go and actually take care of their needs, right? So what do you do with those needs? Unfortunately, you put them on the back burner.
Is
And
there, oh, no, go ahead.
go ahead.
I was going to say, is there I guess, a trend or an area where you see more addiction in, as far as like a certain substance or pills or something that where it's like stronger, you see it in women?
So culturally, right? Because we can break these things down many different ways. So culturally, you may see African American women or women of color typically with alcohol, right?
Mm.
A lot of times that's more socially accepted. So it tends to be a little bit easier to, be home drinking or something like that and really not have it looked at as being a problem. right? Other cultures, you may see things such as pills. And I say that because sometimes it's pills that are prescribed by a doctor, right? Medical professional. But in many cases, they're not prescribed to the parent or to the mom. They may be prescribed to the child, right? So Adderall tends to be one, right? So mom needs a little bit of extra help. And unfortunately, that may be the route that's taken. So cultural differences do play a factor. Access is also another huge one, right? So where's the access? What substances based on, location, based on financial means plays a big role as well.
Mm. Do you feel like a barrier for women getting some help or getting treatment, and men too? I'm focusing on women, but for both of it, do you think it has more to do with the stigma around addiction, or do you think it has to do with like you said, drinking is so socially acceptable? Are they not realizing that they're at the level of addiction?
So I think in terms of the stigma and the barriers that may exist for women or other individuals getting treatment, I think for women specifically, some of that has to do with childcare responsibilities, right? So childcare tends to be a really large one that you see. Their trauma and their anxiety. So go into treatment with previous trauma, whatever that trauma looks like. There's going to be some anxiety associated with it. So not only are you expected to get treatment and support, but that comes with a certain level of trust that you have to have in someone to let your barrier down, to either get the child care from a family member, to pay for child care, right? All those factors are important. And then you think about low wages or less income for women as well. So primarily, especially women of color, we typically get what, maybe one third, if that, of what a male would typically bring home. So if they're single and they're expected to pay for childcare, which childcare is extremely expensive just for one child, right? Not let alone having multiple kids under a certain age. So that plays a huge role in being able to seek services and care. And then the hours is also important to look at, because if they're not flexible, like there's some locations that whether or not the child goes in, you're still expected to pay for that day, right? You still have to pay for that week if the child is off sick. So regardless of those opportunities, your wages are impacted. And other things that come with it, going back to the trauma, if there is trauma, whether it's sexual trauma or otherwise associated, there's going to be a fear about who you let your kids around, right?
Yeah.
So that's another really important thing. And depending on what the legal issues may be potentially with custody and things like that, the idea of going into treatment, because if I go into treatment, will this hinder or hurt my chances? Right? Because now, will the courts know? And then what will that be used as a way of diminishing me actually wanting to get help and support? Once again, back to that stigma, right? Because, of course, this must be your fault. This has to be something that you did. And then just feeling as though you're not worthy of receiving the help. And one of the most basic ones that comes up all the time is really not knowing the resources, right? When you think about when you go to like a doctor or you're first getting a new appointment, the research that you have to do to find someone that you feel comfortable with, it is so difficult when you're looking to find a place to go for treatment that you may feel comfortable and secure. So I think the resources does need to be taken into account as well, specifically for women, because there's not a ton of places that do treatment for women and children either. So,
Those are all such, I mean, not that they're good barriers, but those are all such valid barriers of, the many things. And some of them I hadn't even thought of before, like the going to court and how that looks, that would maybe stop someone from going. Something that we didn't touch on, and maybe I should have touched on it first, is like, how do we, like, what are some ways to identify either with yourself or with a family or friend that they have an addiction. Because as you mentioned, like drinking a glass of wine every night is very socially acceptable. So like, how do you identify when it's crossed that line to addiction?
So the biggest thing that happens when it comes to thinking or talking about the addiction, right, is you're going to notice specific changes in the person, right? So the changes may start off being really small, right? Being late for appointments, not showing up for parties, events, things that the person would normally do, okay? Could this relate to mental health as well, which we talked about earlier? Yes. So that's where it becomes difficult to really be able to assess and tell if you're not someone that has the experience, right? Is it an addiction? Is it mental health? But on top of it, if the person seems to be drinking more, right? And just talking about alcohol specifically, because it tends to be a little easier, they're drinking more. They tend to pass out, black out, not be able to get up on time for certain things after having the night out. Typically, things are connected to going out to drink. Those can be some signs. Are there underlying issues such as mental health? There could be as well. So it's really not one simple way of being able to tell or identify, is this person dealing with a substance abuse issue? So that becomes difficult, especially for the loved ones involved.
Now, what question I want to ask is because there is a substance that a lot of people use. Now it's legal recreationally and all of that. And I often hear people say, like, you can't be addicted to weed. But I'm sure that it's a substance, so there has to be a way, right? But it's so widely used. Like, how do you tell, especially with that substance, if it's an addiction?
So the biggest thing when you talk about an addiction, right? If it starts to take you out of your normal routine, your patterns, right? If I am now using as a way of coping with my anxiety, my depression, with life, that is one of the major ways of being able to tell, right? So there are some substances such as weed that you may be able to get a prescription for, okay? So like most things, if I utilize it for the intended purpose, the way it was prescribed, the way that it says on the label to do so, then and it's not causing me any adverse effects in my personal life, professional life, then most likely I'm doing what I'm supposed to do. If it starts to affect my personal, professional life, I'm not able to sustain or maintain without it. I become dependent on it, right? My ability to function starts and stops with the substance. That is usually a major way to tell that there is a problem.
Okay. And like, so let's say you have that family or friend and you've noticed the patterns that you've mentioned. What are some ways to approach that topic with the person? Should you have an intervention?
That's always a great question, right? It becomes really hard because you don't necessarily, if you're not someone close, I usually start it this way. If you're not close to that person, your approach may not be welcomed. Okay. If you happen to notice and the person is a loved one, you may know the best way. Some people need that direct approach, right? Just tell them straight, no sugarcoating it. Let's just get to the point of what's the problem. And they may take it well. Others may need you to really come to them and explain what you're seeing. So when you say intervention, the concept or the idea of having an intervention really has to take certain steps, right? So if you decide to bring a professional, typically you're going to talk to the professional ahead of time. You're going to set up some boundaries and things that you'll discuss with the person. If it's just a family intervention, typically the people closest to that person will come in. They'll typically talk about their areas of concern, what they've noticed. And a lot of times there's room to allow the person to maybe wiggle out, right? Because now there's a dialogue back and forth versus here are my concerns, this is what I noticed, and this is what I need you to do. Okay. So just like with most things, there's not one way of doing it because treatment is really fluid, right?
Yeah.
You talk about access to treatment, the different barriers, stigmas that come with it. So our approach to it really has to meet the needs of the person. And one thing that has to be clear is a level of support and what that looks like.
Now, when we talk about, getting help for people who have addiction, well, have you noticed any particular like strategies or programs that seem especially helpful in addressing addiction overall, but and then also especially like for women in the Black community?
Mhm. So I think one of the things that is extremely helpful, actually a few things that tend to be extremely helpful, is not expecting there's going to be an immediate change. Okay. Not everyone requires going inpatient. So when you think about it, not everyone needs to go in, but for those that do, having a plan, being connected to their provider. Okay. So if I leave and go into a treatment facility and I'm there for 14 days, 28 days, okay, and I leave from there and come right back home to the same situation, the same environment, the likelihood that I am going to make changes is a little bit more slim. Doesn't mean it can't happen, but slim, because what else is changing potentially around me, right? When there's family or other social supports involved, there tends to be more success. And we talk about things such as like drop down. So if you go to a detox and then to rehab, okay, so just like when you have surgery. So typically you have a surgery and then there may be an opportunity or option for somebody to do rehab. And they go to rehab for the prescribed amount of days. And then, they may tell you when you're home with your family, try to walk with them more, try to do certain things. So incorporating some different levels to that is important versus just expecting that the person's going to change overnight.
Mm.
And another key thing too with the social support, we talk about support groups. Okay. Not every support group is really clear. So one that I'll mention is like 12-step programs. Okay. So typically 12-step programs may not work for everyone. It's very successful for a lot of people. For those that may not work for, things like church, right, may be another area that someone may benefit from going to. So it really just depends on that person's level of support, need, and maybe some foundation on what they already have that exists.
Yeah, and I think, mentioning especially the community support and things like that, because I feel like a lot of times we hear the word rehab and it sounds like this super expensive, super thing that we can't really have access to. But sometimes within our community, we do have access. Someone actually just mentioned, I know someone who was addicted to marijuana many moons ago. His mother sent him to a stay in rehab because he was non-functional.
Mm-hmm.
And sometimes
And
that's needed.
I love that because when you talk about non-functional, right? So going back to the pattern, the person that gets up, goes to work, is involved with the family, they have friends, they're able to socialize or engage in social settings. Well, now when they come up, they smell, they're not put together, right? Maybe they are a little bit disheveled compared to what you're used to. They're not able to function without smoking first or having something in their system. They're not going to work. They're missing days from work because of what happened the night before. Those can be really essential key elements to their function. So I think that was a great point as well.
Yeah, and I think a lot of times when we think about addiction, we think about the non-functional side of it, right? Like the people who mention who suffer from all the things that you just mentioned. But I think there's also a lot of functional addictions, and that's what makes it harder to identify it as addiction because they are going to work, they are doing all the things. They're just, that little extra, that extra drink, that extra hit, that extra pill on top of it. But because they're functioning fine, they're like, I don't have a problem.
So I think that's where we talk about things such as use, misuse, and addiction, right? So to use something for the intended purpose, right? To misuse something, you talk about abusing it, and then you talk about the addiction. So the addiction is when you really notice that they're not able to function without the substance in their system. Okay, things become more chaotic, if you will. So if someone goes out socially, when you go to like the doctors now or certain places, they ask you, do you drink? Right? And one of the first things that's on there, socially.
Yeah.
Right? So some people drink socially. And I'm not referring to, just you go home, you have a glass of wine for the day, right? That may fall into the category as well as socially. Okay. We start talking about the misuse part. So the person that essentially drinks a little bit more, feels tipsy, gets in the vehicle, right? So now we're creeping over because am I noticing that I'm not feeling maybe focused enough to get into a vehicle to drive, right? Do I know what my limits are? Have I met that limit? Am I going past that threshold or that barrier? And those are some areas that are really important to be aware of.
Absolutely. Now, when we talk about, you mentioned that there's different, sections and different ways to sort of break out the understanding of addiction and how it impacts different communities and different areas. Do you find that, or have there been any addiction services that are more culturally competent or that are working towards being more culturally competent, especially for and towards Black women?
I think there are, what I will say is, I will say there are quite a few that work to become more culturally sensitive
Mhm.
and aware, right? And part of how you do that is not just the education, but it's also that inclusivity. Okay. So you look at the approach, you look at the trainings, you look at hiring patterns, you look at the staffing. So on many of the websites, you will see that agencies may post who is actually working at their agency. Okay. And one of the reasons I love that is because you're able to try to connect. Okay. Whatever background, cultural experience you're looking for, you're able to identify that. And sometimes, there's assumptions that, oh, we're looking for someone that maybe looks like us, right? Sometimes it's you're looking for someone that's with the same orientation, right?
Mhm.
And I say orientation specifically because you can really fill in the gap.
Yeah.
Okay. So on questionnaires, some of the questions have now become a little bit more broad, even in the assessment. If you're interested in a counselor and a therapist, what is it that you want? We assume that most women want to see a female, and depending on their experiences, they may be more comfortable with a male. And we do the same thing with men. Assume that maybe they want to see a male or a female versus just accent. So I think the agencies that typically do really well are the ones that ask the questions, the ones that include the appropriate questions. And if someone has completed treatment or they have done step downs, maybe asking them specifically, what was your experience? Agencies that are starting to do that tend to be able to connect more with the next person that needs it. Agencies that employ someone who went through their services do the same thing, right? They're able to get a different perspective. And what's really interesting is we have questionnaires and we have companies outside of substance abuse and mental health that do the exact same thing, right? But with substance abuse and mental health, unfortunately, there's still some of those barriers that exist with bringing people on board that have either, it's almost like an exit exam, right? Or
Mhm.
exit interview. So if I've gone through your program and you're asking me what can be improved, we should be thrilled to talk about that. We should be thrilled to receive that information. But because sometimes you may not want to make that extra effort to improve, you shy away from that information. And one thing we just talked about yesterday in Bible study was remaining teachable. And I think agencies that are open and have people who are teachable tend to go a lot further.
Yeah. Well, that makes a lot of sense because times are always changing, so it's good to change with them. I love hearing that they're working towards being more culturally sensitive because that's definitely needed. Something that you mentioned earlier before, though, was some of the um, access to those resources. What steps are being taken, or what things are being done to sort of address the disparity in access to resources for people within the Black community?
Hmm. I think location is so important, right? So something exists in an area, a rural area, that maybe you have 20 of them in one place, right?
Hmm.
But we know where it's needed and we're not able or willing to put it into those specific locations. So I know there are treatment facilities that not only have peers on their staff and case management and licensed professionals, but they really value what each of these professionals have to say. And they employ people that they want them to come in and really educate their team and they create a platform for that information to be shared. So those services, those opportunities, they're, even when you think about insurance companies, right? A lot of people don't realize they have care managers. One of the best things, like if you go, for me, with my experience, if you go and you have a surgery or at the doctor's appointment or hospital, you have this nurse that may call you to check in. How are your services? Anything else I can do for you? I see your discharge paperwork, right? Have you followed up with your primary care? And a lot of times we're not aware that that service exists. So a phone call comes through, you're not sure what it's even about because there's a lot of fraud that happens. So you're afraid to even answer questions. Programs that have resources, right? You have nurse navigators, you have care managers, case management, and a lot of times they're able to give you the resources. And those resources are not just about their program. So the best resources are the connections, right? Meaning I can go to one program, and if they don't have it, they're able to connect me to another community provider that has that resource. And you think about warm handoff. A warm handoff is not just giving me a paper or a phone number. It's really trying to make sure that I get connected to those resources. And I find that unfortunately in a lot of cases, that part is not happening cohesively. So as a result, the ball gets dropped. And the person who's struggling, guess what happens? You gave me a phone number. I left from in front of you. I'm not about to use that. Not necessarily because I don't want to, let's be clear. But maybe it was so hard for me to get to this step, and now I have to take another step. If you've ever had to wait on hold for something that you really wanted,
and you're just like, forget it.
And after you're done, you're like, you know what, that was too much. I'll do it another day. Now a week goes by and you've forgotten. It's very similar. And we're talking about individuals that already have barriers, both internally and external barriers against them, including that stigma. And let's be clear, sometimes family or lack of support is part of that barrier as well.
Yeah, absolutely. We had a few comments. Gail said that's very true. Absolutely. And earlier, Karen said, I love your explanations. We'll have to share it with a client or two. And Gail said, that's interesting. And then Charles said, oh, good evening. And also awesome information. Yes, I could not agree more. Now, when we first started talking, we talked about all of the letters after your name and how, you have that experience with psychology and with counseling. How do you integrate your expertise in counseling with addiction treatment for your clients?
So I have the added benefit that, when I got started, one of the programs that my school offered was in addiction. And I quickly, you go to college, and one of the things is you take all of these extra credits, but you're not really putting focus into it. And one of the things they did really well is to ensure that if you are taking extra credits, can you actually use it for something afterwards? And I tried to make sure that that's what I did. Now, what also helped support outside of the education piece and all of that was having family members specifically that I could see something was happening, but not understand what it was. And that was the addiction as well as the mental health, right? So you see something, it seems like the norm because you have multiple people around you that deal with it, but you start to notice this can't really be because, my friend Susie over here, her family isn't seeming to be dealing with the same thing. So what's happening? And that was essentially part of the direction that I took in school, and to be educated on what was happening, especially because from a cultural standpoint, what seems normal or what we were used to or are used to doesn't mean there's not a problem associated with it.
Yes. And so it's great that you're able to sort of bring that on, especially because, as you said, sometimes people will mistake the mental health for the addiction. And sometimes it's a little of both. Sometimes it's one hand leading the other hand.
And typically that's what it is. And we have a lot of things that we pass down generationally, right? So, we have these different things we talk about. That's just who they are. That's just what happens. Doesn't mean you getting 3 or 4 DUIs isn't a problem, right? Oh, that's their fifth one this month. That's all. No, that's a problem, right? But when you have those family members that we have created our own stigma, especially culturally, and that's just what we have done, we don't really always know how to handle it, because to be the one that stands up and says something against the grain in itself can cause you to be ostracized in your family or in your culture as a whole.
Mm. Yes, and Charles said that family support is so important when it comes to addiction rehabilitation, which is perfect because that was leading me sort of to our next question. We talked a little bit about that support and the community thing. Is there anything else that either as a family member or the person themselves can do to help reduce the chances of reoccurrence? Because the thing is, what I've heard is that once an addict, always an addict, right? Like there's no point with which, and you can let me know if that's true, like saying it that way. What I've heard is that once you are one, that you're always one, you're just almost like fighting it forever, right? Like once you're an alcoholic, you're always an alcoholic. You're never not an alcoholic. So, what are some things that either as a support system or the person themselves can do to help prevent that relapse?
Mm-hmm. So, what I'll start by saying this, each person usually is able to identify that themselves. So, you'll hear a lot of individuals who are working a program who have had years clean will say, I'm an addict. Some people will say, I'm a recovering addict, right?
Mm.
And that is really how they have labeled themselves a lot of times, because to fight through the addiction is usually continuous. Okay. It hasn't stopped. It's just a matter of how you're working and dealing with it and managing it, essentially.
Yeah.
Okay. So, like with most things, most people are in recovery from something, but it doesn't mean that you have essentially taken that issue off your back and put it to the side. It just means that every day you are fighting to ensure that the relapse does not occur. Right? So, in many of these situations or cases, like we talk, family members or social supports are really important, because it's not always family. So, I want to make that clear. Sometimes it's just having positive supports in your life.
Yeah.
And a lot of times, what that looks like is really just having someone to talk to. Right? So, that's why counseling tends to be so important, because you go in, you feel comfortable, or when you build that bridge to feel comfortable, and you know that this person is not judging you. Okay. There's not a lens that they are necessarily sitting there labeling you, but they're going through this journey with you as a support. With that social support, also, I can share that going to a wedding with a group of people, there's going to be alcohol, that may be a trigger. Well, okay, what can I do as your support? Well, when I go, if you can just make sure, no one hands me a drink, make sure that I don't purchase anything, I don't, go up to the open bar, those things may help. So it's really that the individual going through the addiction or going through the recovery process, sharing what their needs are and being able to identify their needs so that their supports can assist.
And how important do you think it is to identify the source? So something Gail mentioned in here is like people don't want to get close to how it happens to the person in that person's life. It's more relating to them in general public. And I do find that sometimes people don't want to get close or touch the issue, but it would seem to me kind of like a scab, like you got to dig out the dirt, wash it away before you can truly have healing. Is it possible to have that without addressing?
Mm. It's possible to most wounds, right? You can put something over it to really cover or mask it. Okay. If you have a cough, you put a mask on. If you have an infection, then you put something over it. You're not going to get to the root of it. If anything, maybe for a short period of time, it seems okay, right? For a few moments, for a week, it seems okay. But the moment that you are triggered, the moment that something else happens and it has now piled up, right? Now you notice that you're not able to manage and handle it. So trauma is usually a huge indicator. But guess what? We don't walk around saying, I've been traumatized. And trauma is not just about what someone else perceives, okay?
Mm.
It is that person's individual experience of what they've gone through. The person who has been hit by a car, has been in a car accident, that can be traumatizing for them. someone else may not even blink at it. It may not have impacted them in the same way, right? So we really have to pay attention and listen specifically to what someone else is viewing and experiencing as being their trauma. And when it comes to addiction as well as substance abuse, well, mental health as well, sometimes, once again, we keep talking about those overlaps, right? There are things that come up because someone's been traumatized that now these are symptoms as a result of the trauma, right? I'm using and I'm drinking a little bit heavier because I've experienced trauma, but maybe I didn't realize it was trauma. I just may have realized that, listen, when I continue to drink or use, it helps me to sleep. And those things are important to just be aware of.
Yeah. And I think it's really important that you mentioned that trauma is different for everyone. And a lot of times people tend to base it on their own lens of like, would have been traumatic for me, would have been bad for me, but you don't know what else someone is dealing with leading up to that small thing.
And that's one of the things to go back to a question that you mentioned earlier, how can we help? Not downplaying a person's experience is a great way of helping and supporting. Oh, I went through that. You'll be fine. When it comes to trauma, especially sexual trauma, that is one of the things that happens a lot, especially in, our cultural, right? So culturally, you have mom, grandma, great grandmother who have experienced a sexual trauma. So when it comes up, it's not a big deal. We all went through it. That's just how they are. Those are the things that have happened. We just learn to push past it. So allowing people to talk about their experiences is another extreme important way of supporting them.
Mm-hmm. Yes. And Karen mentioned too, it's about how you classify yourself when we were talking about whether you're recovering or still an addict. As a person who was sexually assaulted, now many say survivor instead of victim, which is very true. Trauma and triggers. I was going to say individual. You're hitting all the marks. Yeah, it really is. It really does depend on the actual person.
I agree 100%.
So hello, Robert. And thank you everyone who's been joining. This has been a great conversation. You're always such a wealth of knowledge, and it's a topic that I think people think about, but it's so hard to broach. Like, do you want to bring it up to someone? Like, do you not want to? And so I think it's just good to get that general information out there.
And I think sometimes it's the approach, right? We talk about how it's not always what we say, but how we say it. Okay. I've had moments and situations where even as a professional, I may not be the best person to handle a situation. But if I know one of my colleagues is, then they can take the rein, they can go and deal with the situation, and I can be a support in another way, right? So we really have to categorize and think about it in that sense. Do I have to be the one that is taking the rein? And the answer sometimes is no, right? Maybe calling the friend, maybe calling the parent who there's a great relationship there, and letting them know the concern and allowing them to be the ones that take part in the support.
Yeah, absolutely. Well, I can't thank you enough for your time this evening and for joining me to have this very important conversation. Thank you to everybody who has tuned in and watched as well. Do you have any final words, advice, tips for anyone who may be tuning in?
So I just wanted to say, I'm so glad you were reading the comments and the feedback. I love it. You guys were very active. And I think in this, day and age that we are in, realizing that stigma really does exist. And it's not just the external. We get to a point when we start to have that internal stigma as well. And I think just listening to each other will get us a lot further than we've come.
Yes, absolutely. Well, again, thank you so much for your time and all of you for tuning in. Next week, Thursday, we're ending Women's History Month. I have Aldis West, and we're talking about being a powerful Black woman in a male-dominated industry. So it should be a great conversation. So please come back and join us again next week at 6 o'clock. And check out all the other great shows that are on Feel Good Talk. There's a lot of wonderful information out there and great discussions being had. So thank you all and have a great evening.
Thank you.